I'm going to talk about presenting, planning, and delivering multidisciplinary dentistry utilizing smile simulations. So let's get started with it real quick. My father, Larry, started the company in the early 80s. He is a dentist who decided to open a commercial dental lab. In the mid 80s, he started doing porcelain veneers and, started realizing, cases that look beautiful in the lab on the models didn't always go well in the mouth. And that led him on to introducing the Smile Vision imaging service for dentists, where dentists would send us photos and he'd present a before and after to present to the patient to show them what could be done. So between the two of us, we have decades of experience in creating smiles. Okay, so a little bit about me, and I've been at the lab bench now for a little over 30 years, and I'm an MDT graduate from the NYU School of Dental Medicine. I'm also the owner of Smile Vision Laboratory, and you can just keep going right through these. The co-developer of a number of processes. One's called the template technique, one's called the overtemp technique, and the Goldstein direct bonding technique, which have been around probably for close to 15 to 20 years at this point. And they're all really, really effective, and I'll be talking about that in my presentation. Okay. So go ahead and I'm also a key opinion leader for Dentsply Sirona and a certified CEREC in-lab trainer, CEREC and in-lab trainer. So aesthetics are not a thing. They're an emotion. Okay. And how are emotions best communicated? Okay. There are a number of ways of communicating that, communicating emotions verbally or in writing or in visually through video or photos. Okay, but the old adage of a picture is worth 1,000 words is really the case here. When trying to communicate emotion to a third party. Okay, so smile imaging answers the emotional question, how will I look? This is a pool in our town. A few years ago, they needed to redo it. And so there are 30,000 residents in my town, just outside of Boston. There are thousands of townspeople. There are hundreds of tradesmen that are going to do the job. We all are working towards we all are, with these renderings, we're heading towards a common goal. This is what the taxpayers want. And this is what the townspeople want, and this is what we're trying to achieve. So this is during construction. And of course, the construction project's done. The pool's been open for a couple of years, but this process is not unique. This is how large-scale projects are done in construction, and there's no reason why we can't take some of these elements and apply them towards the cases that we're working on here. Go ahead. So you want to show the patient what might be possible. You can just keep going through the, Chris. So the smile simulations allow the patient to get an idea of what a possible aesthetic outcome might be. We're not talking about the how. We're talking about the what if in these pictures. When the patient says, that's what I want, then it's up to the dentist and the lab technician using Smile Vision to help achieve that result, those results. In the laboratory, we use simulations as a guide for our diagnostic wax-ups. We actually measure shapes and contours and dimensions of teeth when we're doing our diagnostic wax-up phase. Go ahead. So I'm going to show you now a few simulations. We received these photos online with written instructions from the dentist requesting us to show how the patient will look. And specifically, I have 3 cases here I'm going to show you. Specifically, you can show multiple options here. The nice thing is patients like options. And you can present, we recommend no more than 3 options, but it's a really nice way to show options. So start from the beginning, Chris, and just show option 1, which would be just ortho on 7 and 12. Go ahead. Go ahead. One. Okay. And then the next option would be if the patient had veneers done. Okay. So I think that this is pretty straightforward, a straightforward presentation, and I think it's achievable. Go ahead and advance to the next one. Okay. Now, this patient may be complaining about their central and lateral being rotated, so the dentist may request us to show that. So go ahead and advance one. And just watch teeth 7 and 8. And then an additional option might be to show the patient with a complete smile. Okay. Now, these photos are very emotional, and what I think, so my philosophy here in the lab, and I think it's dangerous when you hear technicians talking about aesthetics in the laboratory. I would call them more micro aesthetics, but facial aesthetics. A lot of times the laboratory technicians don't know the patient, never have met the patient, and don't know what to do. In this particular case, and I'll talk about that more in a minute, in this case, the first option is just closing the diastema with Modmouth trays. Okay, the second option may involve veneering 7 and 10, or possibly bonding, or possibly veneers. And the third option in this case is showing the front 10 teeth. You can go ahead and advance one more. And okay, and this may involve tissue recontouring and things that a lab technician can't see just looking at a model.